You're watching Coronavirus in Connecticut. Doctors answer your questions. Sponsored by Hartford Healthcare.
Welcome back to Coronavirus in Connecticut. Doctors answer your questions. When the coronavirus pandemic began here in the U.S. and in Connecticut, most non-emergency surgeries were postponed. So is it safe to resume them? Dr. John Grady Benson is the physician-in-chief of the Hartford Healthcare Bone and Joint Institute. Welcome. Thank you for being with us, doctor.
Thank you for letting me be here, Kara.
When is it safe to get back to the hospital for surgery? I know some people have really been waiting and sometimes in pain.
Well, first of all, we certainly understand the fear of being away from the hospital. You know, when there's a pandemic, there's a lot of fear about getting ill and the worst case scenario, dying. I want to reassure everybody that, number one, we have been working through this pandemic consistently. Mr. Flax has made some very difficult decisions. No hospital employees were furloughed. We were all working. We all showed up. And so through the last 8 weeks, you know, it's part of our culture. Safety has been the absolute #1 priority, taking care of emergencies and people who need time-sensitive or essential surgeries. So all of the protocols about safety have been worked through, and we look at this every single day. It's a large, cooperative, and collaborative team of the best minds in science and medicine, and safety, again, is the #1 priority. At the beginning of the pandemic, there were things we didn't know. Lots of uncertainty. Would I get sick if I came and, for instance, had my tumor removed? Would I get sick if I had my knee replaced or any type of surgery like that? So at the beginning, we made appropriate and careful decisions about making sure people stayed safe, that we contained a virus, and that we protected people.
So, doctor, what about now? I know a lot of viewers are wondering, can I come and get my elective surgery now?
So now that we've gone through this, the answer is yes. It's a complicated answer depending upon how much pain you have, are you suffering from the disease, and if you were to delay another 3 weeks, another 4 weeks, would your outcome be worse after that procedure? And so that differs a lot from specialty to specialty. In knee replacement, for instance, you might be able to cope with the arthritic pain in your knee with non-surgical treatment, and that would be appropriate. However, if you're suffering, if your quality of life is dramatically impaired, and if you were to wait longer, your outcome would be worse, then it is absolutely appropriate and safe to think about having your knee replaced now.
All right. Dr. Grady Benson, thank you so much for the clarifications. We appreciate it. When we come back, the mental health crisis that the coronavirus pandemic has caused. That's right after this break.